And welcome everyone to Continuity Planning Episode 2. I'm Walt Laskos with the Cooperative Credit Union Association, and I am delighted that all of you are able to join us again today for Part 2 in our 4-part series, providing resources to our member credit unions on dealing with COVID-19. With us today are a number of experts, as well as we had on our first call back on March 11th, and we'll be introducing them shortly. But I'd like to kick off today's conversation, which will go until noontime, that's Eastern time, until noon. Let's kick it off by hearing first from Ron McLean, who is the President and CEO of the Cooperative Credit Union Association. Ron?
Thank you, Walter, and good morning, everyone. Thank you for joining us today. Most importantly, let me say that I hope you, your families, and everyone at your credit union is healthy and safe. Today's session is part of our ongoing efforts to provide valuable and timely information to help you respond to the COVID-19 crisis and to help you serve your members and also support your employees. Many of you have shared stories with the association and myself of how you're assisting impacted members, and frankly, it's very inspirational. You're waiving fees, deferring loan payments, offering hardship loans. That all translates into people staying in their homes, keeping food on the table, and assisting their small business. So on behalf of the association, thanks for what you're doing day in and day out. That to me is the credit union difference, again, day in and day out. So going forward, I encourage you to reach out to the association for any assistance. As many of you know, we are fully remote, and we haven't missed a beat. So, again, enjoy today's session, and back to you, Walter. Thank you.
All righty. Thank you, Ron. I appreciate it much. As you all know, we're coming to you today through our live stream service platform that the association uses. I apologize for the rescheduling of this event. We were realizing that we had some issues coming up that really created a problem for us. Hold on one second, please. It just seems that on the phone, when a call comes into my cell phone, it's beeping in the background, so I apologize for that as well. However, let's get on with our program. As you can see, we're making this happen from a little makeshift production studio I set up at my home in Massachusetts. But let's move forward. We have with us today several experts, beginning first with Dr. Nicholas Argy. You all heard Dr. Nick. He's a physician and lawyer with more than 30 years of experience in clinical medicine. He joined us on the March 11th call. Also on the March 11th call was Mike McKenna. Mike is managing partner at Comprehensive Benefit Administrators, an Alera Group company. He'll talk a little bit about benefits and how that relates to us and what the latest is since we last heard from him. And a special treat this morning is Frank Diekman. Many of you know Frank. He's a veteran credit union industry news journalist and publisher, cooperator-in-chief, CU Today, and he's also a credit union development educator, a good buddy of mine. So let's start first with Dr. Nicholas Argy. And Doctor, if we could have you unmute your mic and join us and give us some background of what has developed, what we've learned relative to the COVID-19 pandemic since we talked on March 11th. Dr. Nick.
Well, thank you again for inviting me to speak and give a quick update and answer again questions. What I've been trying to do both on my website and on LinkedIn is basically cut through the spin. Unfortunately, a lot of the advice that's out there, a lot of the direction has a bit of political spin, has a bit of underlying agenda, and I think there has to be transparency and honesty so that people can act in their own best interest and help working together to solve this problem jointly. So I look forward to getting some great questions. Clearly, things have just been progressing exponentially. We're still trying to flatten the curve and mitigate, and I look forward to answering all the great questions that you guys have had in the past and probably have now.
Hey, Doctor, before we let you go and we move forward, What has been the biggest thing that's maybe somehow impressed you since we last talked on March 11th, that you've seen in observing how this pandemic has been growing?
Well, it's very heartening to see that people are trying to take this seriously, and that we're moving forward, not with hope as a strategy, but with data and science being the measure of what we're doing. And I think that's a gentle balance, and I think that it's important that we see that we're listening to the medical experts and not the spin doctors on this. So it's by listening to the medicine and the science of this, we're going to conquer this together. We're going to flatten it, and we're going to mitigate it. So that's very, very heartening, and the fact that people are really reaching out to get the right information. So much bad information has come out. I mean, including the early statements that wearing a mask doesn't make any sense. I mean, it defies any even common sense. So now people are, when they're in public, when they have to go to the shopping mall, going to the supermarket to get food and stuff, are protecting themselves and protecting the others around them. So that's very heartening, and I hope to continue that and see us cut through spin and stick to the facts.
And Doctor, do you when you look at all this, do you really see and feel that, from what you observe, that we are making a difference in kind of flattening that curve?
Well, you know what? It's really on point, because we've seen other countries successfully use social distancing, and we've seen a whole wide range of activities that are being encouraged by governments and public health officials to again flatten the curve and mitigate. I think we're beyond the stage of containment, and I think the sooner we recognize that we shouldn't be traveling all over the place, this concept that they're hot spots and we only have to address the hot spots, I think is a real misstatement, and it underscores the root of the word pandemic being Greek, and my being Greek, pan meaning everywhere, endemic meaning the people. So the fact that we're seeing people migrate out from different areas, I mean, people need to stick to stay-at-home orders until we get this under control. So I think that's kind of the best advice out there, and I'm auspicious that we can achieve some of the success that other countries have seen in doing this. And I think we don't need to let our guard down. I think we need to understand there may be recurrences, and people are talking about this possibly flaring up again in the fall. So I think we just need to keep our ear to the ground and be cautious.
Wonderful. All right, let's move on. We have our next expert, subject matter authority, Mike McKenna. Mike, as I mentioned earlier, is managing partner at Comprehensive Benefit Administrators, an Alera Group company. And Mike, before we kick it off and I turn it over to you, I just want to also acknowledge the fact that through Mike and his generosity, he has been able to put us in touch with Dr. Nicholas Argy. Dr. Nick serves as a consultant to CBA, an Alera Group company. And Mike, we appreciate that, because I think from when we look at being able to bring a physician, a lawyer onto these conversations and really get the facts straight up, that makes all the difference in the world, and it really does prove a lot of value. So thank you for that. So let's turn it over now to Mike McKenna.
Oh, thanks, Walter. Let me start by just acknowledging Dr. Nick's insistence that this is to be taken seriously. Masks are a good idea, and I was, and if you look at even on the state level, the individual state level, how they're being proactive. So, for example, I think you have some credit unions from Delaware on the call. So, for example, the governor of Delaware just put a stay-at-home order for anybody traveling into the state of Delaware over the last 14 days, which took effect at 8 o'clock this morning, and requires them to be in quarantine for 14 days wherever they are within the state. And the only exception to that was if, people can move around if, in fact, they have to care for family members that are sick and things like that. So, and that's similar to what's kind of being tracked in Massachusetts and on the federal level, with President Trump being hypersensitive to the travel patterns of the folks in New York, Connecticut, New Jersey. So I think state and federal seem to be on the same page, and that's a very, very good thing. The other piece of that I want to use my time, if it's okay, there's 6 or 7 minutes that I have, to just reinforce some of the resources that are available to the CCUA. So, and give you some up-to-date information. For example, I know many of the clients that are on the CCUA members that are on the call today may be clients of ours. So for those of you that have telemedicine through us, that's always been a $0 copay, and it will eliminate a claim. If you're not clients of ours, you should also know that, for example, the local insurers, Blue Cross Blue Shield included, have also temporarily eliminated any sort of copay or cost sharing relative to telemedicine, in addition to the any services that are related to the coronavirus. You heard the president mention that Cigna and Humana have both eliminated all upfront costs for services that are relating to those to coronavirus, and that on the local level, the insurers have done the same. So, it's all about breaking down the barriers to get the care that people need in an appropriate setting. And you'll notice that all of a sudden, telemedicine has been at the forefront of the news reports, in the president's addresses, as well as locally. If Massachusetts, for example, Charlie Baker went out of his way to mention to use telemedicine. Mass General Hospital had a statement yesterday to use telehealth if it's available. It makes all the sense in the world if in fact that's medically appropriate. So that should be available regardless of the insurance company you have right now. Those should be zero cost. The other piece to that is we've reached out and have spoken with all of the local health insurance companies. We are anticipating, for obvious reasons, that many employers are going to have to delay payment to their respective insurers. So we wanted to see if there was any formality on their side to handle late payments. The answer is no, unfortunately. However, all of them have responded to us, Blue Cross, Harvard Pilgrim, Tufts, Cigna, etc., that they will handle it on a case-by-case basis. So my advice to you is, if you know it's going to be late, get out in front of it often and early. You should use your broker. So if you work with us or you work with somebody else, they're going to have more leverage than you as a standalone employer. So you want to work with them there as well. The other piece to that is, I made this available, if we're being sensitive for the ability for members to access the care they need, and you see the elimination of the co-payments and co-insurance and things for things related to the coronavirus, you see telemedicine providers eliminating co-pays as well to make sure access is absolute. Something that we have provided to the CCUA, and you may have seen it in the newsletter. If not, we're going to send it back out. But we do have a partnership. My company has a partnership with a very good not-for-profit. How this can help you guys is that we have the ability to offer your employees, whether they're on the insurance or not, let's say they're just part-timers or they're contractors, or you're home with family members and you have, brothers, sisters, cousins. It does not matter who you're employed with and where you get your benefits from. We have a pharmacy benefit that can significantly reduce what you pay for prescription drugs. So in this time where we're anticipating a little bit of barriers towards accessing care and paying for it if they're not working. So, for example, if you have a teller that is hourly and they're not getting the services, the hours that they need, et cetera, or you just want people to shop around, we have that ability. So what I want to do is I will send that out, but it's called Your RX Saver, and I'll make sure by working with Walter that we can get the access code for you guys. So all you do is plug in the password. We made a generic password. Again, you don't have to be clients of ours. This is for CCUA. It can be friends, family. It does not matter. And all you have to do is plug in the name of the prescription. If there's a better and cheaper way to find that drug at your local pharmacy, it'll find it. And oftentimes, some of the things that success stories that we've heard, kids' asthma co-pays that they're paying $150 a month down to $25. We have some drugs that are paying for the co-pays 100%. Some generic drugs are only $4, where they're paying $15 with the local insurer. If you have a health savings account where everything goes towards the deductible, you want to keep the money in your HSA. Try this instead, and that may pay for it, pay for the drug better. So I encourage you to take a look at that. It's not fluff. It's not salesy. Just plug in the name of the drug, and if there's a way to find that it's better, cheaper, and convenient for you, it'll find it. A couple of other things that I want to also just go over very, very quickly, guys, and that is the resource page. And like everything, I'm sure credit unions are collaborating with one another in an unprecedented manner, and that's great. And I got to congratulate the CCUA. Out of all the verticals that we work with, credit unions, not-for-profits, et cetera, you guys have the best communication platform and dialogue going back and forth and out of anybody that we work with, and it should be a model. What I want to just turn your attention to, and again, please, this is not a salesy pitch. This is good information right at the right time. We're actually sharing it with some of our competitors. If you want a very user-friendly, comprehensive resource page for your employer and your employees, go to Alera Group. That's our new company. That's who we're owned by now. Alera Group, ALERA group.com/coronavirus/. That is the address. And there's everything from what you need to know from a regulatory standpoint, what you can do to share information with your employees as to how they can create virtual wellness programs or workouts, things that you can do to pass the time, mental health resources, etc. It is a wonderful resource, and for an HR professional, I think it's a must see. And we're sharing it with some of our competitors, and it's all in the spirit of getting through this together. So I will stop there. The last piece I would say is you should probably think about doing another seminar or a webinar on HR technology to integrate it with payroll to address absence management, FMLA. The resources out there are actually fairly impressive, and our HR technology group stands ready to assist anybody that may need assistance. Or go with your local broker, and if they have resources like we do, they should have an HR technology group that can help use the technology you have to manage the variable enrollment difficulties that a lot of employers are facing. Thank you.
Thank you, Mike. I mean, there you go, folks. I mean, that's certainly a lot of value. Believe me, my mind gets boggled when you start getting into healthcare and benefits. It's just so complex, and it can be, it just leaves you with a million more questions. But I really appreciate having Mike join us and sharing his expertise, because if there's somebody that really understands all this very well and could guide anyone through this maze of providers and all, it's Mike McKenna. So, Mike, thank you for that. Let's move on now to Frank Diekman. As I mentioned earlier, Frank is a cooperator in chief at CU Today. Many of you get that, subscribe to that news collection each day in your email box. He's a veteran credit union industry news journalist and publisher, a fellow DE, and a longtime friend. Frank, let's start off by having you. What we're looking to talk about here today is that obviously, Frank, we have a lot going on with the pandemic. Credit unions may be approached by reporters asking, what are they doing or how are they serving their members, given the fact that you have to have all this social distancing. At the same time, credit unions also have a grand opportunity to tell their story. I'd like to turn to you to get some guidelines for all of us as to working with the news media. The things that we need to keep in mind, what we should be looking for, what we should be thinking ahead of time, how we should be preparing. So I'm going to turn the mic over to you, Frank, and we're all ready to hear your words of advice.
Thank you, Walter, and thank you to the CCUA for having me this morning as part of this call. I've enjoyed the two perspectives shared so far. The first point I would make is, and we talked about the media, is just to keep in mind, before we focus on the mass media, to keep in mind that anyone who has a mobile device anymore is a member of the media. So in all your communication, you need to be consistent and keep in mind that person has the ability to distribute a message as much as is someone who may be a more accepted member of the broader media. So please keep that in mind, that any conversation you have, anything you put out, can be distributed through quite broadly by any of your members or really by anyone else. Beyond that, and working with the mass media, and my first piece of advice would be to keep in mind what it is that you're really trying to convey. What is the point that you want to make? What is it that you want to communicate in any interview? There's an old saying in the advertising business that you should tell them what you're going to tell them, and tell them what you told them. And that's a good rule to keep in mind in any communications you have with the media. The other thing to keep in mind, and there are quite a few things, is that this story is really going to change. Dr. Argy said at the beginning of this call that there's a lot of medical misinformation in the market. There's going to be an incredible amount of misinformation now as a result of the passage of this $2 trillion CARES Act by Congress. There's going to be a lot of deliberate misinformation, people who are trying to benefit from this in one way or the other, and there's going to be some misunderstanding about what's covered and what isn't. I would highly encourage credit unions to be prepared for the kinds of questions they're going to get around loan forbearance. The new law includes some provision about waiving of mortgages and other loans that have any kind of federal backing. So you need to be prepared for that. You need to be prepared for some really tough questions. This isn't just compliance from the credit union side, but in the public arena and dealing with the media. Likely going to be a lot of calls. Could be some bad news stories saying, why isn't my loan covered and this other person's is, for instance. So you want to be prepared for that. But that's just a specific. In a broader term, obviously, credit unions are doing lots of good things. We have documented, as has the CCUA, as has CUNA, just dozens and dozens of special offers that credit unions have out there to help people, and that's terrific. It's a little bit of a commodity, and I hate to say that at this point. It sounds a little callous. But those sorts of good news stories are good, but it's likely that you're probably not going to get a call from the media looking for a good news story. If you field a question from the media, they're going to have some hard questions around, what people are doing. And this is really relevant that you're having this call and this particular point right now, because as we come to the first of the month, a lot of people over the last week or two, couple of weeks, have lost jobs, haven't had to face a credit card payment or a mortgage payment or the rent or a car payment. And those are all going to start coming due here on April 1st. And that's really going to hit the ground as they say, the rubber hits the road for a lot of people. And it's going to get a lot of play in Facebook, elsewhere, and reporters are going to be responding to that. So be prepared for some tough questions, for instance, from the media. And this is an opportunity for every credit union to say, yes, we are, it is a tough time. Here's what we're doing. This is the sort of thing we have available. So you don't want to start off maybe with perhaps the good news stories, because everyone's telling those. You want to be able to tell, the real specifics around what you're doing with real people. Other piece of advice I'd have is to make sure that you are, just another couple of points before I conclude, Make sure you're familiar with what the CARES Act included, so that if you're asked any questions about it, you understand what Congress intended, as well as anyone can ever understand what Congress intends. And to make sure that if you don't understand something, that you let a member of the media know, I don't know the answer to that, but I'll get back to you. The other thing is, beyond just telling your good news story, I'd be prepared to have some anecdotal evidence. You may not be able to cite members by name for all the privacy reasons, but be prepared to tell the sorts of stories. This is specifically what we have done. A member of the media will often lead with that sort of story. They like having the specifics rather than just the generality. Finally, just the final point I'll make is make sure, above all, that the reporter understands what a credit union is. Most reporters now, due to all the cutbacks in the media, they wear multiple hats. They're covering multiple stories across multiple industries. May have been influenced by a bank message that you're just a not-for-profit bank that doesn't pay taxes. So be prepared to, at some point in an interview, whether it's with print or electronic media, that you're able to confirm that the reporter understands what a credit union is, and that's what allows you to do the sorts of things you're doing. I mean, it's one thing to say that you're a people helping people business. That's a little bit cliche-ish, especially if someone doesn't have any understanding of what a people helping people cooperative is. So make sure that you have every right to ask the reporter a question as well, and that you understand what they understand. So those are just some general points, Walter.
Hey, Frank, that was really good. When I start thinking about it, like you say, today you got reporters, a lot of journalists. They're in scenarios where they're wearing multiple hats. I mean, when you talk about, I've been reading stuff now about newspapers and how a lot of newspapers are probably going to take a hit because advertising might be down, given the fact that everyone is hunkered down. But when you think about it, since journalists are wearing multiple hats, can you help us know what's in the mind of a journalist when they are calling us to do an interview? So let's say your assignment reporter gives you a task, you're to go interview X and X credit union. Help us understand what's in the mind of that reporter when they're going to do that interview. What's most important for them? What are they looking for? Are they just looking to, I just need to get the couple facts here, write up a story and bang it out? Or are they looking for something that might be a little bit more moving?
That's a good question, and there's, again, as I said earlier, there's nothing wrong with asking the reporter, what is it that you're working on? What are you looking for? A good reporter is looking to inform, educate, or entertain. I think we can say they're not looking to entertain in this particular area of coverage. So you want to find out what it is that they understand, what it is that they are looking to, what the story assignment was. They may be on a fishing expedition. They may have had an editor who isn't quite sure either, and given them kind of a general assignment. Find out who else they have talked to, get their understanding of it, and then you might even have the opportunity there to reframe it and say, here's what we think the real story is.
Mm-hmm. Beautiful. Thank you. Okay, at this point in time, let me just remind all of our listeners that please, if you have a question for any one of our panelists, Dr. Nick Argy, Mike McKenna, or Frank Diekman, you could email that question to us at communications@ccua.org. Again, that's communications@ccua.org. We're standing by to get those questions, gather them up, and we'll present them back to our panelists. In the meantime, though, as we wait for some of the questions to come in from our listeners, let me just go back to all of our panelists and just invite anyone, if you have any additional comments, given the fact that we've all gone through our little presentations thus far, please share it. Anybody with any further comments?
Hi, this is Nick Argy. I'd be happy to share one thought.
Go ahead, Doctor.
Oh, terrific. So there's a concept in medicine that has been followed for well over a decade, closer to 2 decades, which is called universal precautions. And universal precautions basically means whenever you're dealing with an infectious disease and in a potential exposure, you always assume the person you're interacting with has the condition that you're most concerned about. Early on in the HIV epidemic, thank goodness long gone in the sense of being able to be controlled quite effectively now with drugs, people would say, well, look, I need to know if a patient's infected so I can be extra careful. And the common sense advice that immediately came back was, you never know, even if somebody's been tested, it might be too early. So treat everybody with the highest degree of care and caution. And I think that concept of universal precautions is something that we should just basically assume in the current environment. We're in a pandemic situation, and I think every time you're in a situation, again, where you have to go out and interact, whether it be going to the hardware store to get sanitizer or cleaning products or going to the supermarket to get food, assume literally everybody that you're interacting with is infected with coronavirus, and how would you then respond? And in this way, people can be prudent and cautious and protect themselves and the community at large from allowing the virus to spread. That's it.
Beautiful. Any other comments?
Walter, yeah, I would
Walter,
add one more thing. And this is Frank Diekman. I was just going to add one other point. If you're looking to work with the media on an offensive basis, in which you are reaching out on a story, something that's going to be a terrific news hook and is going to be a heck of a discussion here in the next few weeks or month is the stimulus checks that are going to individual Americans for about $1,200 plus $500 per child for certain families. And there's going to be a lot of questions around how people are going to behave with those checks, what they're going to do with them. For a lot of people, that $1,200 isn't going to come close to really making a dent in their financial situation because so many people are already standing on a fence financially, as we know. And if I were a credit union, a good thing to do would be to start thinking about how would I respond to questions around those checks, and what advice do we have for members and people in the just in the public on what's the best way to handle those checks. Is it to pay down debt? Is it to set it aside? Just how would you approach those checks? That's going to be a big story here over the next couple of weeks.
Okay. Anyone else?
This is Mike McKenna. A comment on Cobra. If the organization is considering some temporary layoffs, and they offer the member a Cobra solution, but intend to hire them back, remember, they have 60 days from the point of offer to retroactively accept or not accept the insurance. So you hate to put anybody in peril, and you don't want to do that. But remember, if you think it's going to be short term, that member has 60 days to retroactively sign up and pay for Cobra. So there is a little bit of breathing room if you're considering short-term scenarios.
Okay. Thank you, Mike. Mike, one thing I wanted to ask you, and we talked about it, or you talked about it earlier, referencing telemedicine and, how that is expanding and how we have opportunities through our benefits to take advantage of telemedicine. Is there, for more information on that, is there a place that we can go for that? Now, I suspect that we probably already have something about it on our coronavirus website on ccua.org/coronavirus. So there may be a link there, but is there offhand, can you share maybe someplace else where folks could get more information?
Probably the most effective way, we have a lot of marketing material that will explain it, but if anybody wants detailed information, just email my assistant, Casey Southwick. It's K Southwick, SOUTHWICK, at cbacompanies.com. Why that's important is there is an expansion of telehealth that's going on. And most of the telehealth programs out there now have plans to or are currently offering mental health services on a telemedicine platform, and many of them will offer if it's a copay. So, for example, if you have a Blue Cross plan, I think there's a $90 copay for those services. There are services out there, telemedicine companies, that will waive the first three, again, in an effort to just get the member engaged without having the financial burden of getting started. So, and the reason why sending something to Casey is that obviously we monitor it. We obviously have 800MD in a lot of our solutions, but we also have aggressive contracts with Teladoc and things like that. So it is a good resource to have. I'm not sure if there's a separate telehealth function on the resource page that I referenced earlier, but I will check. And if I Walter, if I find that, I will of course share it.
Correct. And anything else that we may have missed that it's not there, I'm sure, Mike, that you and I will coordinate, and I'll make sure that information or links are on our resource page so we can share that with our member credit unions as well. We have one question that has come in for Dr. Argy. Doctor, this questioner says, or asks, I should say, as we begin to emerge from our hunkering down at home, should we be taking any precautionary measures? Should we be avoiding large groups for the time being, continuing to wash our hands? Some guidance, please.
So that's a great question, and because we don't know when this is going to end, when we're going to flatten the curve, and whether we might get a recurrence. So I think it's always wise. I've always found it unusual. We've gotten various advice from various very legitimate sources. The state of Massachusetts heard comments about groups of 250 people or less. They reduced that to 25. I was listening to an update just this morning, and people were saying stay out of groups of 10. What I would suggest to everybody is that until we have established that viruses can count, I think we should just stay away from people, period. It just makes no sense to get into a group of people and just stay socially distanced. And I think that should continue indefinitely until we get an all clear sign from, obvious evidence that we're over the steep part of the curve. I mean, one of the things that is a great lesson here is that we have accepted as a society that influenza will kill anywhere from 20 to 50,000 people a year, and we don't lock down our society. Coronavirus is a very different situation where hundreds of thousands of people will likely perish due to this novel virus. So I think the concept, and if anybody takes this moving forward, God bless them, we should always try to wash our hands and to be very cautious and be really enforce, especially the concept of presenteeism. If you're ever sick, whether even long after coronavirus is gone, and I hope that happens very quickly, please stay at home, and socially distance from your own family members in the home. So hopefully the takeaway message will be lifelong, that we ask people who are sick to distance themselves and to stay minimize risk to others, whether it be influenza or coronavirus. And I think that way we will learn a valuable takeaway lesson that in years to come indefinitely will save lives.
Doctor, I think it's also interesting here that, of course, we have Frank, who's down in Florida. We have a much warmer climate down there than there is up here in New England. I think there are people who think that, well, once it starts to heat up outside and gets warm, all this is going to go away. Will there be a bearing? Does temperature, does climate, will it have a bearing on this?
So there's a lot of wishful thinking in that regard, and the real answer, a lot of people, again, are putting spin on it, but the real answer is we don't know. So we've had experiences with MERS and SARS in the past, and it seems like they are seasonal. But the reality is, corona is spreading pretty aggressively in Australia, not as a hotspot, but it's spreading, and it's summer there. Mm-hmm. So, the current thinking is that, maybe it will follow a seasonal and temperature-related degree of spread, but then again, it may not. And we just don't have the answer on that. And again, my general philosophy, a philosophy I share with my family, my friends, and my followers, is basically, when in doubt, be cautious. So I think we should assume that it's not going to be seasonal, and until, again, we establish that it is seasonal and that we may have a window of opportunity to resume our lives as normal as opposed to what we're dealing with now, we should just basically assume and be cautious in all our social distancing until we learn objectively otherwise.
All right, thank you, Doctor. And again, for all of our listeners, if you have a question for Dr. Argy or Mike McKenna or Frank Diekman, email your questions to communications@ccua.org. We'll grab those questions and pass them on to our panelists. Frank, I have a question that came in. Is it good to use a script when you're dealing with a reporter, or does doing so make it appear phony to the reporter?
It makes it appear phony. I can always tell when someone is using a script, unless they're just an outstanding actor. When they're reading their remarks, it doesn't sound natural. It sounds canned. I am less likely to use those remarks. Now, I have no objective no objection to someone using bullet points. That makes perfect sense. It's easy to lose your train of thought. I certainly do myself. And so you can certainly adhere to some bullet points that allow you to stay focused. But if you're reading from a script, it sounds like you're reading from a script. It sounds like perhaps you're trying to dodge the question. We all see politicians when they do that sort of thing, and we're suspicious. So, my other piece of advice on that is, use the bullet points, but be concise. Is my other piece of advice. As I said earlier, you want to focus on a couple of points, but be concise. Don't be long-winded. Understand what it is the reporter is looking for, especially if that reporter is interviewing multiple sources for the story. In that case, a lot of what you have to say isn't going to be used anyway, so you want to hammer away at the points you want to make, and you want to sound every bit as authentic as people who are not using scripts.
And I would probably think that having like a key message point, if there's one thing that you want to impress this reporter with, that you have that as your key message, even if you have to return to it a couple times in your discussion or in your dialogue. Do you concur?
No, I absolutely concur. As I said earlier, it's tell them what you're going to tell them, and tell them what you told them. Return to those points, especially if it's something that you really want to convey. Keep in mind that the reporter wants to do right by the reader. The reporter wants to inform the reader of information that will be helpful. The reporter wants his or her story to be read. So they're looking for good information that the reader can act upon. The reporter isn't despite the climate we're in, the reporter isn't looking to build some sort of adversarial story or to attack the credit union in any way. That person wants to help the reader, wants to help the consumer, and credit unions are in a unique position to provide that kind of direction.
Perfect. Thank you, Frank. Let's take a moment here and go down to Delaware, I should say, to our sister state in the CCUA. Carol Langiu is down in Delaware. And Carol, I just want to reach out to find out, do we have a question or two that might be coming from folks in Delaware? Carol.
Thanks, Walter. Yes, actually we do. It kind of piggybacks on one of the questions that you had for Dr. Argy about the social isolation and how long we should continue after things kind of break. And this question is because the virus is in different counties or different parts of the same country even, it's in different phases of the pandemic. So that 14-day social isolation is kind of like a rolling calendar. Dr. Argy, do you think that it's just going to kind of go on, or will once a vaccine is created, it'll stop the virus in its tracks?
So that's just a phenomenal question. So thanks to whoever asked it. So the concept of the rolling calendar is just crucially important, because what people need to understand is that even if you isolated, and this has been brought up in the media before, let's just say you took the entire world for 14 days and froze it, literally froze everybody in place, and then everybody within exactly after 14 days could start living their lives again. Would we then cure the virus? Would that be a magical cure? And the problem is that depending on when you get infected, or if you're in in the incubation period, or your incubation period lasts a little bit longer, it may not be a perfect opportunity of curing and getting rid of the virus altogether. So I think it's important to recognize that every time, even though you isolate for 14 days, every time you go to the supermarket and do an essential function, which we all know we have to do, again, you roll the 14 days forward. So it is an ongoing 14-day roll forward. We just hope by social distancing, the degree of interaction of our population is so significantly reduced that it flattens the curve. But it is absolutely true, and a great question, that it is a rolling calendar, especially considering every time you go out to shop, the calendar moves forward another 14 days. The other question that was asked in combination was the issue of a vaccine. And while I want to, be as optimistic and upbeat as possible, I think the vaccine needs to just be openly and transparently discussed. Vaccines don't appear in 12 to 18 months. It took 6 years to develop the Ebola vaccine. Many different viruses we've never been able to effectively create a vaccine. And understanding the logistical difficulties of creating a vaccine is given to healthy people. So if it is just crucially important that we have a vaccine that is not only effective but is safe, because you don't want to give a vaccine that could exacerbate/worsen the situation. So I hope and pray that we get a vaccine in 12 or 18 months, but if you ask experts who've been working on vaccine for 20, 30, 40, 50 years, that is really, I think, very much a long shot, and I hope I'm wrong. So that would be my caution with regard to hoping for a vaccine within the time frame of 12 to 18 months.
Hey, Doctor, when you look at all the talk today, you hear about the Spanish pandemic, the Spanish flu, and how many people fell victim to that. I don't know if it's comparing apples to apples here or not, but projections when you look at the coronavirus, COVID-19, and what we're dealing with. You're a straight shooter, straight talker. Are you expecting that this could overshadow what we've been through back in the early 1900s, or are we going to get our hands around it?
So another excellent question. The good news is that the current mortality, other than in Italy, for coronavirus is most people are predicting around the 2% range. And again, there have been tons of people spinning it to saying it's equivalent to influenza, which is an absolute misstatement. Even the most conservative people say it's 10 times more lethal than influenza. And hopefully it doesn't reach the 10% range, which left 50 million people dead in 1918, with 500 million people getting infected. Back in 1918, there were 1.8 billion approximately people in the world. Now we have close to 7 billion people in the world. And various models by experts, one in particular, Mark Lipich at the Harvard School of Public Health, anticipated somewhere between a 40 to 70% spread, which would mean that up to 4 billion or more people could get this virus. I think that's a worst case scenario. And so I don't want to be an alarmist or create that kind of an expectation. But, again, the modeling has suggested that it could be that high. And even with a 2% mortality, you're talking about 80 million people dying. So I don't think we're going to get there. I don't think it's likely that it'll be that severe. But again, I think what was described, I think, accurately by one virologist is we're getting pixels of a picture, and we're getting more information every day, but we don't have enough pixels in the picture to make out what the true answer is. So, we just need to be cautious and wait and collect the information.
Excellent advice, Doctor. Thank you. Mike, we have a question that came in. If you could share again Casey's email address, folks wanted to be able to get information again on how to communicate with you directly. So, Mike, can you share that, please?
Of course. It's K Southwick, SOUTHWICK, at CBA Companies, companies is plural.com. So K Southwick at CBAcompanies.com. And in the subject line, just put in follow-up questions, something like that, that'll flag it immediately.
Thank you, Mike. Frank, another question that has come in here. If there's one not to do when dealing with the news media, what is it?
Don't overpromise what it is that you can do. Don't overstate what it is that you can do, and don't, in this particular case, imply, as was mentioned, that there's any sort of a vaccine for your finances that's going to cure everything. There isn't, but the credit union can certainly help you along the road to recovery, help you to weather any financial illness, if you'll excuse the bad puns. So just don't overpromise, and it's going to be a difficult situation for a lot of people, but the credit union has the opportunity to stress the message that we can help you get through this difficulty.
And might I add to that, in addition, be truthful, because if you really do not tell the truth, it will come back to get you, right?
Absolutely. The other piece I would stress too, Walter, is make sure that whatever it is you have to say is consistent with what you're saying on your website and in your other electronic media. You do not want a reporter saying, well, it says on your website A, and you just told me B. So make sure you're pretty consistent make sure you're completely consistent across all your channels and in your communication.
Okay, and again, if our listeners have a question for any of our panelists, the email is communications@ccua.org. Let's see here. Dr. Argy, we have a question here. I've heard reports that the virus will be around for at least 2 more years or so. How does that work? Does the virus go dormant? And then what brings it back?
Another excellent question, and almost all the excellent questions, the pixels haven't, come together yet so that we have definitive answers. So probably, I think about 4 to 5 weeks ago, the CDC announced in one of its prescient memos that they thought that this could last to 2021. And of course, that was not widely publicized since, there are forces at play who thought we would be back to normal by Easter, which is clearly highly, highly unlikely, if not frankly impossible. So the reality is, again, if we're students of history, Spanish flu lasted somewhere between 18 months to 2 years, and it had 3 peaks during that time period. So do we understand exactly why? No, we don't. But if we are going to be students of history and maybe take a worst case scenario, that is not unlikely. An 18 to 24 month time frame is not unlikely. And frankly, Tony Fauci, who I think is just superb and has not succumbed to spin in politics, has already predicted that he thought there would be a reemergence in the fall. So we still have, I think, a long road ahead of us. But again, we're doing the best we can, and I think we've mobilized our forces quite well. So I think that time will tell, but I think again we need to be prepared for a different way of living day to day on a longer time frame. And again, I hope I'm wrong, and I hope we're back to normal in 3 months or 6 months. But again, the experts don't uniformly agree on it. And again, caution is the better part of valor. So be prepared for a bit longer of a haul than the optimists may be getting out into the media.
All right, thank you, Doctor. Let's go to Donna Bevilacqua. Donna is on the CCOA team, and she's monitoring questions that might be coming in from the states of Massachusetts, New Hampshire, and Rhode Island. So, Donna, do you have anything on your end relative to our panel questions?
Yes, Walter. Question was asked if Mike McKenna could repeat the URLs he gave for the Alera group for the resource page, as well as the information he was talking about for the prescription saver and the website for that.
Michael?
Of course. Yep, of course. The webpage for the resource is www.alera, A-L-E-R-A, group.com /coronavirus /. So aleragroup.com /coronavirus /. The information for the prescription saver program, the best thing to do is we actually have a video tutorial on how to use it and what it does. So again, Casey Southwick stands ready right now to receive your requests, and she will set you up not only with the video but also a generic login so you can start using and saving and passing along. And it's K Southwick. It's KSouthwick, K Southwick at cbacompanies.com. Again, K Southwick at cbacompanies.com.
All right, thank you, Mike. Folks, remember that this whole session today is being recorded. The recording will be posted to the CCUA coronavirus resource page, so you'll be able to go there and listen to everything that was spoken and shared this morning in case you missed any pertinent information. We're drawing to a close. We have about 5 minutes left. What I would like to do now is just go one by one and ask our panelists for any kind of closing remarks that they could share with us before we sign off. So let's start with Frank Diekman first. Frank, if any closing comments?
Yes, Walter, thank you. I would say that this is an opportunity for credit unions to position themselves as sources of trusted information with the media. This is a story, as mentioned earlier by the doctor, that this is going to go on for some time. The media is going to look out for independent sources that aren't looking to sell something. Credit union has a terrific opportunity to position itself as a source of unbiased information. And beyond that, the credit union is also in the trenches and on the ground, has firsthand stories and anecdotes. You should be paying attention to those as a credit union, collecting those, be willing to share those, and really take advantage. And finally, I would say you don't need to wait for the media to contact you. You have every opportunity here to make your local media aware that you are a source, that you're close to the ground on this, and that you have information to share that's of benefit to everyone.
Thank you, Frank. Mike McKenna, please.
I guess I'll close with just a reinforcement that actual services for the coronavirus, if they have insurance, should not be a hindrance because the out-of-pocket costs for those services have been waived. Telemedicine, whether you have our programs or you use the insurer ones, or your broker may have a proprietary one, those should also be a $0 copay, and you're going to see a spike in telemedicine services. And please reach out if you'd like to spread the word on saving for prescription drugs. It's K Southwick at cbacompanies.com, and we're happy to assist.
Thanks, Mike. Dr. Argy, closing comment?
Yeah, be delighted to sort of conclude by saying people should listen carefully to the information that's being presented, be cautious, and always have questions. If something doesn't make sense on a very common sense basis, please, get more information. Certainly feel free to reach out to me. And I just want to sort of end on an upbeat note because, if we follow this good advice that we've heard and engage in acts of love and kindness and compassion, we'll get through this together.
Thank you, Doctor. Before I call on Ron McLean for a closing comment, let me remind everyone again that any questions that were sent in that did not get answered, we'll forward them on to the panelists. They will respond and write their answers, and we'll post that to the resources page, coronavirus resources page on ccoa.org. In addition to that, let me remind everyone that on Wednesday, April 1st at 1 p.m. Eastern Time, we have Continuity Planning Episode 3 in the series. We have John Cutchie, a director of the Eastern Region of the National Credit Union Administration, will be on the panel. Chris Gill, Senior Manager, Risk and Compliance Solutions at the CUNA Mutual Group, will be with us. Rob Sarno, strategic account person with Agility Recovery. So Rob will talk about the continuity planning aspects. And we also have President and CEO of Dover Federal Credit Union, Chaz Riznicki, will be with us to give us a boots-on-the-ground perspective from Dover Federal Credit Union and what Chaz and his team are dealing with and how they're managing expectations of their members and serving their members. So we invite you to register for that. Join us for that conversation as well. That's again Wednesday, April 1st at 1 p.m. Finally, episode 4 of our series will be this Thursday, April 2nd at 11 a.m. And joining us on that conversation will be Dr. Linda McKenna Gullin. She's a professor of psychology at Marymount University. I think it's very, very important that we talk about stress. We talk about anxiety and how we're all dealing with it, particularly if you find yourself being locked up in a house, you know, with kids and your spouse and grandparents or older folks. You know, and that could be tough, trying to do your job and at the same time, be in the midst of all of it and also worry about everyone's health. So that's going to be a very good conversation with Dr. Linda McKenna Gullin, professor of psychology at Marymount University. Also on that call will be Sean Daly. Sean is the new president and CEO at People's Credit Union. And Blanche Jackson, she's the president and CEO of Stepping Stones Community Federal Credit Union down in Delaware. So they will both Sean and Blanche will give us a perspective again from the local credit unions, how they are dealing with the scenario that we face day to day. Finally, now let's go over to Ron McLean, President and CEO of CCOA, for a closing comment or two. Ron?
Yeah, thank you, Walter, and job well done, Walter, today for pulling this off, and a lot of hard work goes into it, so thank you for that. A big thank you to Nick, Mike, and Frank for being on the panel and for sharing your insights and comments with our membership. And I'll kind of follow Nick's lead on this and share some positive closing comments. And, we know it's hard now, but I have no doubt that we will get through this together. We'll get through it as credit unions, united, and also as Americans. So, again, we know it's a challenging time for all of us right now, but we will come out of this somehow stronger and better as a credit union movement and as a country. So stay strong and continue to reach out to the association for any assistance. We'll do the same. And thanks for everyone for being a part of today's session. Thank you.
And thank you, Ron. Thank you, Nick. Thank you, Mike. And thank you, Frank, for participating. And thank you, all the listeners, for being part of today's program. Look forward to having you join us again. Don't forget, Wednesday, April 1st, 1 p.m. for the continuation of this continuity planning series. Again, I'm Walt Lascos. Thank you for joining us. And that concludes today's program.